I'm doing a study that considers 4 types of PFAS. They are correlated with some pairs being, with some pairs being more highly correlated than others. They have similar chemical structures and are measured in the same units, but they have quite different concentration levels. How would you suggest deciding whether it is most appropriate to use the actual concentration values or a log transform of those values, or to use standardized values, which could lose the absolute differences? So the question is comparing maybe on a log scale, using those concentration values or standardized values. The concern being that the standardization might change the estimated association with the outcome. And we can clarify, and anyone online, if you want to clarify your question after reading it or after the panelists discuss it, please feel free to send in a updated question. So any reaction to the first one? Yeah.
So, I think these do different things, right? If you log your exposures, that changes the distribution of the exposure, and that would change the association. So that has issues with interpretability, right? If you want to inform regulatory action, and let's say for PM2.5, and you've logged your PM2.5, now the association is at the log scale. EPA doesn't regulate particles at the log scale, right? Also, there's no assumption for normality and the exposures or the outcomes for that matter for any of these methods. However, methods that are extremely sensitive to outlying values for model fit, then there is a benefit in logging just to improve model fit. So personally, and I know there are different camps on this, unless things are really, really messing up model fit, I don't prefer logging. Having now standardization does not change the distribution of the data. So the exposure response relationship will hold whether you standardize the exposure or not. And the benefit of standardization that standardization has is that it brings all the exposures on the same scale. So then that improves model fit as well. There are certain functions that if you have very different scales in your exposure matrix, the method will complain. That's official terminology there. Sorry. And so I don't think there's a downside on scaling. If it's a linear relationship, then instead of per 1 unit increase, it's per 1 standard deviation or per IQR, depending on what you've used for the standardization. But I think in almost everything that I do, if it's more than 1 or 2 exposures and there are different scales, I think I standardize. Same with confounders as well, because that can also be an issue for model fit.
Thank you. Dr. Wenquist, did you have something?
Yeah, actually, this was originally my question. And so I'm wondering if there is possibly a downside to standardizing, in that a 1 unit change in a standardized value is going to represent a larger absolute change for the variable that has the higher concentrations. And so if I see a stronger association with the variable that has higher concentrations, I might not know whether it's because it's really more potent or just because that 1 unit change in the standardized value represents a larger change in the concentration of that variable. Does that make sense?
It does. You can translate back everything to a 1 unit afterwards. So the beta coefficients are scalable, right? Because now the standard deviation or the IQR is just a scalar. So if you want to compare then toxicity, you can fit the model with the standardized exposures and then rescale every coefficient to represent a 1 unit increase. So now they're all per 1 unit increase.
You think there's still a benefit
for model fit for sure, and especially in methods like PCA, for example, or clustering that really aim to get total variability, to look at total variability of the data, then if you don't standardize, you may have one or two variables really influencing the entire solution just because their concentrations are so much larger. So their variability will be larger. So I don't see a downside in standardizing, but I don't know what others.
I was just going to add, I have seen the case when that there's a real advantage to centering and scaling in the sense of the ill conditioning of the covariance matrix. In the case, and I may have this backwards, if it's higher, I guess the more potent, but then it looks like the betas are really small, and then the standard errors are small, and the variances are even smaller. And then your covariance matrix looks like there's zeros, right? 10 to the minus 12 or whatever in your covariance matrix. And so you can have some real ill conditioning with that. So I think there is an advantage in putting things, you know, on a standard scale. And back transforming, I hadn't thought of that, but I think that's a good idea as well.
But may I add something? For the outliers, we have to be careful also for the standardization.
Yes, standardization, yes, keeps the, so. yes.
Otherwise, the effect estimates can be very much corrupted, right? So
Could you speak into your microphone just a little bit?
I'm saying we have to be careful about the outliers. I mean, even if we standardize, we should take care account whether there is the outlier or not.
Right.
Otherwise, the effect estimates might be very much corrupted. And
Yeah, thank you both or all of you for the comment.
Yeah, I mean, I can chime in specifically for the BKMR approach. So I do recommend definitely scaling it if you're going to just apply the R package sort of off the shelf, because then that will just, in terms of how smooth the exposure response function is, it'll work with the priors that are already implemented in the R package instead of you needing to specify your own priors for each exposure based off of its own scale. So I do recommend that for implementing it. And also there's not really a harm in scaling the exposures or in transforming the exposures if they're highly skewed, because then when you plot those exposure response functions, you're going to have really uncertain estimates of the exposure response function in places where the data is sparse. So if you transform it and it's more normally distributed, then you're going to get sort of better estimates of that exposure response function. But then given that, you could then, with Bayesian inference, it's really nice because you can then get posterior distributions of your quantities back on the original scale. You can say, I want to get the predicted value when it's log transformed, and then you can back transform it and get a posterior mean and the posterior confidence interval, or credible interval, I should say, for that back transform quantity. So you can get the benefits of getting better model fitting, but then get posterior distributions of quantities that you're caring about on the original scale, if that was of interest.
Can I ask a follow-up question on that? Clearly not the biostatistician here. If you estimate, let's say, if you have a logged exposure and you estimate a linear association, and if it were in the raw concentration, it would have been nonlinear, then how can you back transform, when you back transform the log, the exposure response function estimated with a logged exposure, would it now be nonlinear in the raw concentration one?
Yeah, it could certainly be linear in one and nonlinear in the other.
So it's, you
absolutely.
actually recover the relationship with the raw concentrations then?
Yeah, and you'd have to still be careful. Like you might not want to do it in places where you don't have a lot of data because you would still have that sparsity issue.
Okay.
But even in terms of like the numerical summaries, you might care about the numerical summaries at a specific value. But the ones that I presented were based off of like quantiles. So if you do a transformation that keeps the same order of the variables, then you're still going to be comparing, the quantiles are still the same, just on the transform scale. And so you can get those numerical quantities would be of interest if you cared about sort of the third versus the first quartile, like the examples that were shown. But you could also put in specific values, like you care about values of PM 2.5 above sort of some regulatory threshold. You could put that in as where you want to look at your exposure effect. So you're pretty open in terms of the different ways that you're going to summarize that exposure response function.
Okay, thank you. So this next question is from for Dr. Kuyumortz-Aglu. And thank you for your presentation. How would you approach the analyses if your mixture contains chemicals with known health effects based on abundant data, and contaminants of emerging concern for which the health effects are unknown, a limited available data.
Thank you. So if I understand the question correctly, I think this is where Bayesian methods can be very, very powerful because you can incorporate prior knowledge. So if you already, if your mixture has many exposures and you have some pretty well established, knowledge about the association of some of them with your outcome, then you can put a tighter prior around that knowledge on those coefficients and leave the coefficients for the associations you don't know as non-informative or much weaker priors. Having said that, how easy it is to actually do that in something like BKMR, like actually go in and tweak, it's possible, but if you are not very well, Bayesian and code savvy, how easy it is to actually go in and do that, or something like BART. That I don't know. So I'm looking at Jen now, yes.
It would be a little bit hard in terms of like the prior distribution for those RM parameters that were unless you kind of knew how smooth the exposure response function was. It's possible you would, but it's not like that parameter has a very clear interpretation. You'd have to kind of see how different values would perform. But one thing you could easily do is say that I'm going to force in the variables that I know are already associated from prior studies and not do variable selection on those. And then you could focus the variable selection on the variables that that have more limited evidence. So that could be kind of one approach to sort of incorporate some prior information by just having your model force those in. They could have a small effect still, but they would never come out of the model. So that would be I think that's already could be.
That's a very good idea. And you can do something like this. You can do this in Lasso and ElasticNet also as well, right? Because right now we force in confounders only, but you can force in part of your mixture. That's a very good idea. Yeah.
Maybe a more simple strategy could be in the back of your head, you remember that you have this relationship that you feel comfortable with. Do your analysis and investigate. It's kind of like an internal positive control, right? Do you see what you think should be the case in your analysis? And then relative to that, the things that are unknown, are their estimates or their impact or whatever in the analysis strategy you have, are they in the same ballpark? Are they, you could kind of compare what you know more about to what you know less about, but maybe not be as complicated. Just do the kind of strategy that you would do otherwise, but just kind of think about that in terms of your interpretation of the effect sizes or whatever it is you're doing. So I think it's a kind of an interesting study where you had that sort of balance between those. I think you could really kind of key off of that, right?
It does sound interesting and probably not so uncommon. What about moving those known variables into the covariate category?
I think there has to be, I think there should be prior hypothesis for that. I mean, prior hypothesis for that or prior knowledge that they can be treated as covariates or confounders in that sense. We can move that. Just because it doesn't have effect doesn't mean it should be moved to a completely different section. The ill side of putting all of those exposures with no effect in the set of covariates, it's more like playing with the data, and you might end up getting some associations out of nothing. Possibly there should be some prior knowledge before doing that, I would say.
Yeah, but I mean, that was the idea. They had prior knowledge about those some subset of the exposures.
Maybe some sensitivity analysis.
Yeah,
Uh,
that sounds.
With all of them together and then separately, and see like if the effect estimates drastically change when they're being included and they're being not included.
But also I think it would depend on the method, right? Because let's say you have WQS, and yes, you know that these variables are more, you have prior knowledge, right? If you move them in the covariate, one, they don't contribute to the index, so you lose that information from the index, and you also don't get their weights relative to all the other exposures. Similar with PKMR, if you don't include them in the kernel, then you don't check if they interact with the chemicals you don't know much about, right? So it might be more powerful if you act on that prior knowledge and move them on the covariate side, but you also lose information on your exposure mixture.
Good point. Thank you. Any other comments?
And possible, one comment will be possible interactions. I think that's what you talked about. I
Yeah,
mean, probably the prior knowledge is on individual associations or association as a mixture, but just because individually they don't contribute doesn't mean that there isn't any particular combination, which might also combine with another set of other combination, and that might create a effect.
right. That
Because
makes-
they are chemicals after all, so.
Okay, that makes sense.
Yeah.
Okay, so asked during Dr. Midja's talk is the next one. Questions for all speakers, actually. Wonderful talks. I'm interested in trying to apply some of these methods. Oh, in occupational health. I was supposed to delay that. It is time, I guess. This one we said we'd try to answer at 3:45, but it is that now, so we're okay. I wanted to make sure I didn't do it too quickly. I'm interested in trying to apply some of these methods in occupational health settings where we often have extremely small sample sizes for particular job titles, task groups. If continuous exposure variables are available, do you have any recommendations for which methods or settings may work better in these smaller data sets? And then to clarify, this is to identify exposure mixture relationships with a health outcome within smaller groups of workers. This could be for identifying the toxic agent, overall mixture effect, and so forth. So
Can I ask a clarifying question here? Is the question that you have, let's say, like, I don't understand the relevance of the job title. So is it 12 job titles and you have 5 subjects in each? So the problem is that you have a small sample size within job title, or is it an overall small sample size question? Because that might have different answers.
okay, we could wait for a
Answer both.
clarification.
You can assume 2 different questions.
Yeah,
Start
exactly.
answering. Yeah, I'll go with the small sample size. For sure, we cannot use the click methods for that. If the sample size is too small, I don't think machine learning methods, any possible machine learning methods should be used. Having said that, as I was talking about, probably any bootstrapping. Even if you have small sample size, create multiple bootstraps and then use your favorite methods and try to see the distribution of the effect estimates. Although this is not the best, at least you will have some idea of the distribution. If the distribution literally is symmetric around the 0,
Right,
then probably there is nothing. But then if there is a particular tendency on the positive or negative side, then probably there is something there. So I would suggest like bootstrapping from the small sample size many times and use methods like WQS, probably BKMR, but also it depends on the number of exposures. Because if you have too many exposures, then you possibly cannot use many of these methods.
okay, well, thank you. So that would address it at least if the question is about small sample size in general for this one.
One additional comment I would have is if the sample size, even if you get, if say you have 20 people total, right? Then I would be concerned about generalizability of that, even within the bootstraps, because you're still, any inference, you're still depending on, 20 subjects. Now, is that all that different if your study has 300? Like, why is that necessarily all that much more generalizable? But I don't know, that would be my concern there.
Yeah, good point. Okay, there are 2 more questions that came in. Oh, please.
I was just gonna comment that like for the semi-parametric methods, we're trying to use the data to like achieve multiple different goals. I might sort of maybe pick one goal and then versus, I guess I haven't evaluated BKMR really small. So that would be another one with very big and very small number of exposures and the smaller sample sizes. In principle, it could have more exposures than you have number of observations. But if you have a really small number of participants in your study, I might stick with more simple models, like maybe allow for maybe quadratic terms, depending on how many exposures and how many people you have, and maybe not do that most flexible model and look at linear and quadratic types of nonlinear effects and maybe simple first order interactions if you can, but you're going to be more limited. It'll probably be more exploratory of trying a few different models versus potentially you could do BKMR if you have like a sample size of 50 or 100, but I think smaller than that, I would be hesitant to use it.
That's maybe where dimensionality reduction methods may be useful if your exposure matrix is very large on the column side. So then you at least, assuming you can get interpretable answers, reduce the dimensionality, or that's where it maybe creates some index somehow. If you have something like a toxic equivalency index, or even just in that case, if you are interested in the overall effect, assuming equitoxicity is not great, but if you only have 20 subjects, then yes, maybe the first step, the most simple one would be scalar your exposures, sum them up, assuming equitoxicity, strong assumption, but see if there's something there with that.
Sorry, go ahead.
No, I was going to say, I think I think they referred to occupational exposure studies.
Yes.
The occupational exposure data I've seen over the years, not a lot, but that I have seen, the structure of the exposures are really very simple, right? It's not a continuous biomarker. It's more of a yes or no or a high, medium. So if that's the case they're thinking about, I don't think we can use some of these methods.
Yes.
Yes. So this is where it would be nice to sit across from this person and start asking more questions
Right.
about the data structure and really what's
Right.
happening, not just with the, because if that's the case, then we need to think about it a little differently.
Right. Good point. So here's just a general question. What are the emerging frontiers and key areas of future research within multi-pollutant exposure modeling? And I think you've kind of addressed that to some extent, each of you. Some of the research, like with Dr. Minja, was published last year, or this year, I guess, earlier this year. So, but any key things you might care to mention? Future areas of future research and
It depends if it's methodological or not, because we can come up with a million different, and my biostatistician friends probably more than I, different questions methodologically, and look at the limitations of current methods and try to address those. I think the important next steps for me, and I know Chris is working a lot on this, is how can we, like right now, regulations regulate single pollutants. We don't regulate really mixtures. So how can we inform regulatory action for mixtures? And so that requires not only a lot of thought process from the policy makers, but also for us to think how we can design and conduct our studies to give results that are actionable for that purpose. And I do not know the answer to that, but I think that's the next, because I know, for example, EPA has been talking about this for years and years. And one of the issues not doing it is, okay, how do we do this? So I think that's an important.
Yeah, I mean, I absolutely agree with what you just said. I mean, there's a push, I think, a lot of times to reduce the number of animals that are used in toxicity testing and things for regulatory things, and I'm all in on that. I think, though, that we still need to have information that can be used. I think, there's a big push for the NAMs, non-animal methods. Is that what the NAM stands for? Something like that, but the modern sort of way of looking at that, which tend to be a lot of high dimensional information. I think two biases I might have. One is I think there's a lot of, this idea of the exposome and these higher dimensional omics and all of this. I think we really need to be careful about using omics as, the new fancy thing to do. And it's all, we can be more high resolution, or we can have more, we can look at so many more dimensions. But at the end of the day, we need to carry along the biostatisticians and the new methods with it, because at the end, we might have all of this really fancy data, but then what? And so many of the studies I've seen of late. A lot of it is more of the focus on measuring and not so much and then what do we do with it, right? Yeah.
I mean, it
so-
works really
so I
well.
I think that needs to play a part. But I also think that, you know, we need to get to the place where it is a research question to say, how do we go further to where we are and actually make some decisions to get rid of some of the exposures that we have in our environment? I don't think it's acceptable anymore to keep these chemicals in our lives just because we haven't kicked it down the road one more time, you know? And so I call on the NIH to start funding methods and thoughtfulness for you know, carrying out some things that we can make decisions on and actually get broad sets of chemicals out of our environment. We can't just do it one molecule at a time. We've really got to get past that.
And emergence of new chemicals, right? Because BPA, right? You take BPA out or certain flame retardants and then 20 more pop up. Whereas, yeah, yeah, good.
I'll also add something. It's more about, because we have so many methods, we need to be careful of how to use them and how do I say? There should be a guideline of reporting. Like, well, I am using this method and this should be my parameters and this is what I'm using. Because otherwise many of the results are very much opposing, depending on example, like seed, for example. There should be a focus on, well, if you're doing a mixture methods, you make sure that you do 100 seeds or like 50 seeds. There should be guidelines like this and they should be followed up through. Reporting in that sense.
Yeah.
It should be enforced. I mean, we see a lot of new papers on machine learning and they're trying to predict something, but then, well, what are the steps that you are following, right? There has to be a training set, testing set, and the validation set. Are you really following through this, or you're just like showing something which is, it's not there as such? So reporting is there, should be enforced.
Right. Good comments. Thanks. Okay, another question. Oh, Andrew.
Just one question that I have been thinking about is, I wonder how we bring causal thinking into this issue of looking at mixtures. And I'm concerned, you know, if you think about, there are certain causal structures that can cause problems if you put more than one pollutant in the model. For instance, if the two pollutants are correlated because they have a common cause, and then maybe the association between one of them and the outcome is confounded by a variable that you're not measuring, and that variable doesn't confound the other association. You know, there are some causal structures that can cause bias amplification. And I'm wondering whether any of these techniques really address that issue, or is that just still going to be there with any of these techniques?
There are some methods that are being developed around that and that are based off of graphical models. I don't remember names of the methods right now on the top of my head, but I've definitely seen abstracts, seen presentations in conference, so it's picking up. But these methods, you know, they're first published in statistical journals, and by the time they become digestible for the rest of us, it takes a while. I think the important thing is always start with a DAG, with a graphical model, and run sensitivity analysis and see, yes, what happens. Although I would say that it'd be hard. It depends on the study design, but coming from an air pollution, ambient exposures realm, it's hard for me to imagine that you have a source that gives rise to two pollutants and you'd have one confounder, a confounder associated only with one of the two. Usually the confounders are associated with the sources, right? Mark Weiskopf and Tom Webster. Yeah, that's what you're, okay. So that's a very good resource. That doesn't hold, that's more for biomarker studies. It doesn't hold in the example that I just said, for example. Yeah, that was not an answer though. So yes, if anyone else has an actual answer.
I might sound like the old lady in the room that's really cranky, but what is the phrase, you don't let the perfect be the enemy? What is that phrase?
Good, yes.
Of the good?
Yeah.
You know, at some point, there's going to be always something could happen or it's going to be bad in this way, whatever, are we going to stop at the boundary and say, well, we can't go further? I mean, or at some point, is it okay to say there could be some limitations? Maybe we overstepped a little bit, but let's push. I mean, you know what I mean? Sometimes I think we're just stagnant to move forward because of all the what ifs this, what if that, right? I'm not trying to minimize that research. I think it is important research that they do, but it's always going to be complicated, right? So is an approximation going to be good enough? And that sort of thing, just to keep going forward.
And it's a very, like, if you throw into the mix, we talked about potential differences in confounding, but there are differences in exposure measurement error. There are differences in how much missingness you have in each of your, right? There are differences in the variability, which impacts the statistical power. So it gets very, very complicated. And we tend to ignore like these issues because And then you need a lot of data and you need, we'll have work to do for many, many years to come.
I think it's more also true for the multi-omics push, because now people have metabolomics, microbiome, then metallomics, and you name them, genomics. I mean, people haven't been even incorporating genomics as much. So controlling for all of this causal part there, I think it's tricky, but I think, the statistic literature probably definitely will come up with different solutions to this, but I think there is more research to be done there. But again, I mean, I want to come back to the last question, which was like new frontiers. I think multi-omics probably is, and people are trying to incorporate multi-omics in different ways. But then again, what does it even mean? Like, just because I'm adding another layer of omics, am I adding something more to the topic, or am I giving some precise estimate? Like, what is the eventual aim? That I think we need to define at the end of the day.
Yeah, I like the question, Andrea. It raises a lot of questions and perhaps caution and need for more, some of that future work we're talking about, perhaps.
Yeah, I was going to answer that prior question about that being one of the frontiers. Is a lot of the causal inference methods have focused on like a single exposure that's dichotomized. Right. So there are like generalized propensity scores, but I don't know if I've ever seen like a real world, many real world studies that are using those methods. So I think that is where people are heading. I think that's a really important direction. Like I've really valued how the causal inference world has really put a push on the assumptions that are kind of behind the hood of some of these methods and thinking through, like we do a regression and it can give you the same results as some of these other methods, but thinking through what the assumptions are, like, oh, positivity might be violated, and then you're extrapolating and you're going to get really wrong results. So I found it in the simple setting to be really useful to think about some of these things. And I think it'll add a lot to the mixture space as they're sort of brought together. So using that mediation analysis as an example, I highlighted, Marianthe had like the slide with the 4 different sets of assumptions behind it. No confounding to all these 4 relationships. And in practice, it's unlikely that those are going to be whole, but those assumptions can then inform sensitivity analyses, where you can see how big of the unmeasured confounding there would be in order to take away that effect. I agree with, on the other hand, with Chris saying that like, in terms of making real world decisions, you're not going to have the perfect evidence. And so even with sensitivity analyses, it's likely that under plausible values of the sensitivity parameters, you're going to go to null effect. And so needing kind of a decision theory perspective of like, what are the benefits and harms of regulating things that maybe don't need to be regulated versus not regulating something that should be, and those types of issues, that's a really big challenge. I don't envy the regulators needing to bring all of that evidence together, but I do feel like the causal inference framing and the assumptions and thinking through what's being assumed behind the methods is really valuable. So I appreciate that area of research a lot.
And I might just add one more thing. Is it on? It might be that there's always going to be limitations on this causal inference from observational data, right? But to be able then to go back into say, let's start doing dose response models of mixtures that are environmentally relevant, put them in vitro assays and see, can we show mechanistically understand what's happening? And that's causal. I mean, that's a dose response study, right? So if more sort of connection with what we might step forward in that with whatever limitations, but then maybe do some additional in vitro studies or whatever that might either explain the mechanism or at least demonstrate that there is thyroid dysfunction or there is, you know, whatever is that you're looking at. So that mirroring of the observational with more in vitro sort of assays in mixtures, I think is a good place to go.
Great, thank you all. Oh, another, yes.
My name is Victoria. Dr. Bob, you spoke on the importance of the goal we are trying to achieve when any study is done. So,
Step closer to the microphone. We're having a little trouble hearing you.
okay, I should do it. Hi.
Just really close.
So I was talking, Dr. Bob, you spoke on the importance of the goal we're trying to achieve. So, and this question is for you and the rest of the panelists. So I am an epidemiologist. I'm working with the lead poisoning and prevention program with the Mississippi State Department of Health. And of course, I'm sitting on a lot of data. So my question is, while the physicians back there don't think that lead is such a public health issue, right? Do you have recommendations on maybe analysis options or methods or packages that can be used to achieve / buttress the importance of recommending tests for children under 6 years, as lead poisoning is still very much a public health issue?
I'm sorry, I was hearing parts of it, but I wanted to make sure I'm fully understanding the question. Are you asking about like the scientific results from the Bangladesh study where it looked at the metals with child neurodevelopment, or about like the choice of methods in those settings?
So I'm saying if I wanted to like look into studies, because of course I'm working on a lead program, right? And then but the physicians are not ready to recommend the lead poisoning prevention testing because I don't think it's much of a public health issue. So do you have recommendations on packages if I wanted to do an analysis, or anyone who wanted to do an analysis to kind of show that it's still very much a public health issue?
So you have exposure to lead like in a data set where you're measuring that, and what are the outcomes that you have?
Okay, so I haven't done so this is the thing, I'm an epidemiologist, right? So we get the results reported back to us when the tests are being done in the state, right? So we have these results, but the question now is how to do a research with it and the best methods and ways to go about it so we can have data-driven evidence, right? To be able to prove that it's still very much a public health issue.
So it sounds like you have like testing that's done, and
Yes.
is it like state
Yes,
level testing?
Yes.
So you have like values for each state has like how much lead is
no, just each county
each
in
county.
Mississippi, yes.
So it might be one where we'd want to like maybe meet afterwards if you're able to stick around to like better understand the details of the data that you have, because you want to think about kind of what your outcome data are, and is it on like a county level? Because maybe it's doing a county level analysis, so some type of spatial analysis. If you've got exposure at a spatial level, outcomes at a spatial level, that'll be more sort of looking at spatial correlations. But I think trying to maybe have a consult and we could talk more about the details of it. Because it could really very much depend on the sort of the structure of the data and the types of exposures and outcomes you have.
I think that's a general issue though, definitely for lead, but for other environmental exposures, that at the individual level, they tend to have small probability of an outcome. That is true for lead. It's very toxic, but it's still, if you are not exposed to very high doses, so you don't really get, actually poisoning to get to the hospital. Same for air pollution, same of all of this. Individual level risks are very small. But once the exposure prevalence is near universal, then the societal population and societal risks are very high because the numbers add up. So that's when we're talking about lead and early exposure, for example. Then if the neurodevelopment of the state's children goes IQ, let's say, whether we believe in IQ or not, for the sake of this argument, if the IQ on average if the IQ goes down 2 units for one person, no big deal. If the statewide average IQ goes down by 2 units, that's a big deal, right? So I think we need, as researchers, with you, figure out how to make that message more loud for physicians, for regulators. And I think that's where things break down, because yes, I can understand that. I think my students can understand that, but I don't think, I have the same issue with air pollution, right? Killer in cardiovascular disease. How many doctors do you think talk to their cardiovascular disease patients about their air pollution exposures? So I think that's a very important communications issue. And if you overcomplicate this with overcomplicated analysis that no journalist, no physician will understand, then that's part of the problem. We do need those methods for sure to get robust, results that are close to causality as much as we can. But we need to figure out a simple and impactful way to communicate back. And I think that that's where we're not doing such a good job so far. I don't know if that was. Yeah.
Absolutely. Thank you very much.
I know you wanted to say something too.
No, so you covered it.
Okay, well, thank you. Thanks for the question also. Was there another question over here?
Yeah, I have a question. Do you feel like your institutional environments and your funders adequately recognize and incentivize the maintenance of the packages that you develop? I'm just wondering what goes into the statistical computing element of all that. And if you have any recommendations in that regard for the field and the research community?
Can speak to this a little bit because of the R package that I had. No, I mean, it's partly because my focus is largely on electronic medical records data and health services research. So I've moved to my research area a little bit, but in terms of, yes, it's constant work to maintain an R package. I have a list of requests and I'm just sort of derelict on addressing those requests because it would be doing it in my free time. I did see as a promising development, I saw an R03 NIH grant mechanism that was specifically about software packages. So it's not a lot of funding, but the idea was that can you bring in computer science principles to build upon research products? We often will have the R package is even often not done, but even your script that implements your method. But I do think that's really important once methods have been developed to be able to have software and to keep it sustainable is challenging. So I'm seeing sort of some hopeful news in this direction, but just from my own experience, once you've your 5-year grant or whatever it is has ended and you move on to the next project, there's really nothing that is enabling you to keep that going unless you're doing it. It's kind of the problem with open source. A lot of free work is going into open source work in general, and it's the same with scientific stuff as well. So yeah, I kind of have a laundry list of things that would be great to be added. And so I guess if there were people who are interested in doing that, it's on GitHub and people can contribute and submit updates. But it's hard to get that work funded, but it is promising that I've seen that R03 recently. And I think there could potentially be nice work with the mixture space to try to get some of these code and software up to date with more features and kind of with people who really have that training to build software. Because a lot of us kind of do that on the side, but there's ways to make it better if you really come from that training.
And can I add on this, please, it's not only the funding, but it's also if you're in certain positions, let's say in academia, is how it takes us so much time to put together a package and to maintain it and to make sure, it works with all our updates or whatever software you're using, right? And then if you're in a tenure track position down the line, all the time you spend there versus you could have published, 10 more papers or submitted 3 more grants, right? So I think it's an enormous amount of work that's not necessarily appreciated and acknowledged yet. And I see it with my postdocs. Sometimes Like, I would not actively pursue a specific thing just because it will be great for the scientific community, not necessarily for their career. And that goes back to the practice question that we had, right? So I think we need to figure out a way that that's fundable, that there is support, financial and personnel, to maintain this, and that also these are recognized in the career of someone for promotions, etc. So I don't know how to do that. Yeah.
Okay, well, thank you for sharing those ideas. Okay, we have a couple more questions. So there's been some recent work to account for measurements below the limit of detection and exposure estimation, Bayesian modeling and so on. Do these methods that we discussed today or other methods have strategies included to try to account for these values below the limit of detection? And I think you mentioned that specifically, but
Should I re-mention it?
yeah, and any other thoughts since it came up?
So, I mean, yeah, so we did talk about that earlier, and that is that if you have limit of detection values that you know about, and you can really make in the WQS and other things, you can actually make it a 0, right? You don't really trust it. Okay, make it a 0 and then look for concentrations higher than that. It's also the case that measured values below the limit of detection may also be okay to use. I mean, I might not believe that a value below the limit of detection is going to be a reproduced number, but at least it's lower than something that's higher than the limit of detection. And maybe that's enough of an information. So I think it's interesting if you're really interested in looking at the distribution of concentrations or things to get an accurate estimate of those numbers. But I'm not absolutely convinced that in regression models it's required to understand what's really going on below the limit of detection.
Some say shameless self-promotion here. PCP, principal component pursued, if the research question of interest is pattern recognition, actually allows and works very well with values below the limit of detection. And we've shown it works actually very well in recovering simulated associations if the value, if it's, up to 75%, I think, below the limit of detection, depending then, that depends the cutoff of below the limit of detection and how many chemicals, that's a balance there. But actually, if interested in exposure pattern recognition, PCP has a version that works with values below the limit of detection.
I think most of the methods that we usually do in the regressions, they're missing under the assumption of missing at random or missing completely at random, right? I mean, which doesn't happen usually, but let's say missing at random. But the cases when missing not at random, MNR, I think,
Right.
that's when I think the tricks, I think, as you're talking about, it will be interesting to see the exposure patterns. But then, so that's a completely different question. Like if the missing is not at random, then what is really happening? Then that's a whole different scientific question than looking at, well, assuming they are missing at random or something like that, or Chris's method, what she was saying, like, well, keep them as it is at 0 and then basically do your
Right.
quantile or something else. That works. And sensitivity analysis, keeping them outside it, putting them together, I think.
Right.
But I think we should be careful about distinguishing what's missing as opposed to what's not measured below the limit of detection.
Yeah, that's-
So if for data sets where that's kind of joined together, that's a problem. But yeah.
Yeah, I was going to make the same comment because there is information, even though it's below the limit of detection, there's some information there.
Yeah, but it also depends on like who is measuring it and which lab is measuring. Sometimes, yeah, it's like the machine readable values. They just like throw out sometimes. Although there are values, they're not really values. So I think it also has to be.
Rumor has it CDC does not release back values below the limit of detection. So I couldn't help myself.
Okay, well, thank you. Let's see, we do have 2 more, I think. This is a follow-up question from a different person about the standardization question that came up early on, the first one, I think. how would the panelists address, how would the panelists recommend addressing outliers, whether real or the result of being below the limit of detection readings? In a challenging scenario, how might you address inconsistent detection rates across chemicals? So it's getting at some of the things we've talked about. For example, I want to study chemicals A, B, and C, which had limit of detection rates of, say, 0 to 50%, a big range. A common approach is to impute the values below the limit of detection to LOD over the square root of 2, but these imputed values can look more like outliers compared to the readings above the limit of detection. So it captures some of the things we've talked about already, but I don't know if you have anything to add, given the slightly different question here.
No, I just wanted to mention that it might also depend very much on the biomarker that you are looking at, like blood, urine, or hair, or teeth. The definition of outliers change from one biomarker, to the other. So I think we have to be careful about that.
Right.
Just using the same method for all of them, or the same media is very much shouldn't be applied. It should be different for different media, I think.
Right, good point.
No, I was just going to say though, but if you're talking about the situation where 50% of the observations have values below a limit of detection, centering and scaling is a little complex, right? So in that case, I'm a quantile person. I, transform to zeros to be,
That
and
captures a lot
then
of-
quantile above that. But yeah,
That
so it
captures-
depends on the question about that, right?
Right.
And I would also say it's very hard to distinguish what is a true outlier versus what is just a very high value. So I wouldn't necessarily just discard values that are very high as outliers. I would do sensitivity, and I'm a huge, and I know with Doug, I'm a huge fan of sensitivity analysis. Do the results change a lot? The results maybe don't change at all. Like how does my data set behave? But also, I think that's where, especially when we have complicated data sets like that, looking at the data before jumping into the analysis is extremely important. Diagnostics, histograms, correlations, bivariate plots, all of these, or univariate plots outcome. It's sometimes you get a data cloud. It's not very, but if something is really an outlier, maybe sometimes you can pick it out. So sensitivity analysis, and before jumping into the analysis, very detailed descriptive statistics, so you can understand how the data set, so how the data behave.
Right. Good advice. Thanks.
Yeah, I mean, I agree with being a fan of the sensitivity analysis. So like you could set it to different values, like 0 or to the smallest value that's above the limit of detection in your data set, rerun it. Maybe ideally you would kind of know from like the makers of the test some information, and if you wanted to be Bayesian and like had a lot of time to do the analysis, put some type of, do some data augmentation, and you could impute and kind of do this hybrid approach where you impute the missing values and then you fit some type of mixture analysis approach within a Bayesian framework, and that can kind of account for that. But it's easy to say that, but it's like a paper to do that. Like it's not straightforward. It would be kind of implementing your own algorithm often to run it. So that's where it's like practically, probably if I'm doing it for like an applied analysis, I'm doing more of the sensitivity analysis route. But then if I'm able to do like a methods around it, and I haven't been exploring the literature, but I'm sure there is a lot of work done with imputation and missing data methods when you have below the limit of detection. So it might be possible to kind of combine those methods with some of the ones we've talked about today.
Yeah, I've also seen some other methods where in mice, R package, you basically create multiple data sets, which are slightly different from each other. And you basically run the analysis for at least 3 or 4 of them. And you expect that the effect estimates or whatever you're looking for, they're not changing as much. But then if they do, then definitely there is something going on, and you have to go back again and do some more analysis there. So I've seen papers like that also. Yeah.
Good. Thank you. So last question, and I think actually most of you or maybe all of you touched on it a little bit, but already, based on your experience, what disciplines would you include or collaborate? Who would you collaborate with to advance or enhance the methods for analysis of environmental mixtures in EPI. Yeah. I think you all mentioned, getting the clinicians involved or subject matter experts, but anything to expand on that general?
Toxicologists, clinicians, computer scientists, exposure assessment experts and outcome experts. I guess that'd be clinicians, not necessarily, but yeah, biostatisticians for sure. And then it depends on the
Psychologists.
question, huh?
Psychologists and
If the
psychiatrists.
outcome, yes, exactly.
Depending on the
Yeah,
outcomes.
yeah, yes, absolutely.
I think nowadays there are different methods of doing the laser spectral analysis, I think. So chemist in that sense, like it's a broad way, but still like they have some intuitions and they come up with different methods, just like biostatisticians. They also come up with multiple different methods. Now, which one actually should work? We don't know yet as much, but yeah, I think.
And policymakers for translation.
Oh, good point.
It's such an important topic, all hands on deck, right?
Yes.
Right, yeah. Okay, well, that wraps up the questions. So,
Over here.
oh, you have a question?
So,
You're
thanks,
next on.
Dean. I wanted to make sure everyone got a chance to get some questions in, but I have a question to go back to you all. And you're all experts in this field. We have covered spatial EPI methods in the first workshop and dove into cancer clusters and things like that. Last year, we were doing looking at causal models from across the spectrum. From your perspective, what other types of EPI methods in development that's going on within the discipline? What really excites you that you want to learn more about that you think would be really, I'm biased, helpful for public health? And where do you see some of the really leading innovation outside of your own areas in the discipline and moving public health forward?
Quasi-experimental designs, I would say. There's a lot of information that could be used, and there's a lot of methods development in that area. So yes, that'd be my, not the only answer that I would give, but that's definitely the one that popped first into my mind.
I would like to learn more about neural networks and all these transformer kind of models that have been like used in machine learning, and trying to like see if they can be somehow used in our context. One of the things is like we do a lot of research in environmental epidemiology, but then classifying this research is very interesting. Like, so transformer type of models probably can be used there, but I mean, that is something that a collaboration with a computer scientist, particularly in environmental epidemiology, as you were saying, is interesting. And another possible field is looking at teeth and the hair data, not at the concentrations, but at their patterns. So all of the talk, I mean, mostly we have been talking about the concentrations of the intensities as such, but not the pattern of exposure in a long-term solution. So that is something is coming up slowly, and there are many different teams, not a lot, a handful of teams are doing such analysis. So that's probably another frontier, which will probably become very prominent in the next 10 or 20 years. The pattern, not exactly the concentrations.
Maybe this is a little bit of, well, it's my own bias for sure. You asked the question in the sense of improved public health. There's so much that needs to be done to improve public health in terms of exposures. And at some point, we're going to run out of patience for it to happen, right? And it gets to the point where it's what can an individual do to improve public health? Because I can control me, but I can't control all of that out there. And to my mind, that's nutrition. And that's, how can we improve our own situation? And there may be guidelines in terms of how to accommodate the exposures that we have, but it's not happening at a fast enough pace to get rid of these chemicals. Are you kidding me? We still have PFAS that are being created. I mean, really? So, if you're talking about public health, maybe we can look at things in terms of in terms of nutrition. The other thing, though, has to do with, I said this a minute ago, and I really do believe it. I think the NIH needs to open up its pocketbook and start really a push for improved methods for taking it to the next step. How do we answer questions, and maybe even scientifically, but how do we answer questions that really help risk assessors to make, and policymakers to make decisions that actually change things? Because writing another paper about the, what, I don't want to sound snotty about things, but, at some point we really have to start changing things. And so,
In the context of perhaps implementation science.
yes.
Prevention, yeah.
Measuring the impact of making different changes or whatever. But I think scientists, we can make up strategies for doing that sort of thing. Let's measure it. Let's see the impact of that. But we need to have funding for that. The NIH won't fund that, right? Bring it, NIH.
We need to start thinking of how to design those studies to
Right.
begin with. This is a
Right.
new, completely new mindset.
Right.
Because I agree, like there's so many, oftentimes I say, if I see one more paper on PM 2.5 and cardiovascular disease, I'll just jump off, right? But yet, so yeah, absolutely agree, Chris. That was an excellent, yeah.
Prevention strategies, basically, right? Like
Conduct studies to inform. yes.
inform, like microbiome could be another frontier. Microbiome and environmental pollutants could be another frontier. Nutrition and environmental pollutants. I mean, these are the things that you can probably change right now. We cannot go back and change the pollution, for example, let's say India or China. I mean, you cannot really implement all of those, but at least we can change what you eat, what you can take, and
Thank you. Oh,
Environmental justice and climate justice methods as well. I'm guessing you're asking for future workshops as well. So I do
well,
think
yeah,
methods
future
for
workshop
environmental.
ideas are great. We would
Um,
appreciate that from you all or anyone else online. But I'll just bounce back to that then. Are there methods that aren't being used that could help answer those questions related to environmental justice, health equity? There's just a disconnect between the disciplines. That if we got them together, we'd be able to answer questions more creatively and impactfully than before.
I'll start by saying I'm not an environmental justice expert. I've done some work, but by no means I would say I'm an expert. But I think we see a lot of studies, and I've done some of these studies that are nationwide and claim have environmental justice implications. But I think environmental justice is very local at times, and it looks different from community to community. And so I think, I don't know if it's a methods necessarily question, but I do think community-based participatory research can be very impactful for those types of analysis. And I think teaming up with experts in that field and bringing in the communities and finding a way to parameterize community wisdom and knowledge into our models, it's very important. I don't know how to do that, but I'm sure there are people who do and who have thought a lot about it, much more than I have.
I would throw out also, to try to answer your question, certain quasi-experimental studies. It's not going to be applicable always, but difference in differences, interrupted time series, regression, discontinuity studies, they can often address effects in practice. But again, not every situation is going to fit that, but I think they could be used more.
Very good. Anything else online?
I haven't gotten anything passed along.
Okay, well, I'll come up and join you here.
Yes, so let me thank the panelists for coming and presenting and talking and discussing. Really appreciate it. If we can sit. And now Dr. Svensson will give closing remarks. Last year.
So thank you all. Thank you all online for sticking with us for so long. And this was such an animated. Are these on? Okay. Thank you for sticking with us online. Thank you for this wonderful dialogue. And just for those of you online who can't tell, that's water, that's not coffee, yet we still had a really animated discussion. So this has been a great workshop. So, we already congratulated, thank you all thank you to our speakers. But we have a team behind this. I also wanted to thank our team behind all of this and pulling this together. So our communications team, our program team, planning team, and specifically folks in the back, our AV folks here in the room. But from the team within our program, we have Brandy Longmire, Captain Fuyen Yip, of course, Dana on the planning team, Commander Johnny Daniel, Sarah Siegerlin, Denise Gahn, and Andrea, who you heard from earlier. So many thanks to you all for planning this all and putting this together and making it happen. And again, thanks to our communications experts, Jonathan, and everybody else on your team, Jonathan Lynch and others, and Kagsy. Oh, you're still there. Thank you for your help too. So this has been going on for 3 years. I mentioned it just over there. We want to be timely. We want to be able to provide the types of topics that are really innovative, driving environmental public health forward, where there's untapped opportunity. This issue where we're talking about a disconnect between the science and practice, and I've been in some venues where colleagues have called this the valley of death, where we have science that goes up on a shelf somewhere that no one in practice actually takes and puts it into practice. And if folks in academia knew that their work was not impactful, I think they would be traumatized, because everyone wants their work to be used. And so how do we continue to do that? So we're trying to provide the discussions around those types of topics. So thank you for bringing this wonderful discussion about these mixtures methods, and how to really use the advances in science to look at creative, innovative research questions. So many thanks to you all. And just a shameless plug, we're going to be hosting the joint ISEE-ISES here next year. And we're looking at seeing how we can have continued conversations that are really focused around harnessing the strength of environmental epi and exposure science methods to advance public health forward in new ways. So more to come on that in the future. But many thanks to you all sticking with us, for all 143 of you who are still online. And we're looking forward to continuing to bring to you these types of engaging discussions, and look forward to seeing you next time. So thank you.